Thank you. And thank you, Bianca and Alexis. I think you do bring up some very valid points regarding the importance and benefit of the SNAP program and the pandemic we're in at the current time. COVID has upended the world and norm as we know it. I believe we can all agree upon that. But the debatable issue here is whether we're throwing money at the problem will fix it in any way. Additional money allocated to the SNAP program will simply not fix the problem. This proposed increase in SNAP funds are temporary anyway, from January 1st to June of 2021. As mentioned, the Supplemental Nutrition Assistance Program should be just that, a supplemental program to aid the income of low income families. It is inherently a government derived program to allow low income families to purchase nutritionally dense foods for their families. However, as several studies have indicated, as participation in SNAP increases, so do obesity rates, while the labor force rate decreases by thousands per year. Less people working, more people on food stamps, more obese children and adults. Despite the purpose of the Supplemental Nutrition Assistance Program to help low income households obtain more nutritious foods than they could otherwise afford, researchers have also identified that the receipt of SNAP benefits is associated with more rather than fewer hardships. In recent years, more states have introduced work requirements for low income applicants who are able bodied adults without dependents. Due to the effects of COVID, however, the requirements were lifted. Governmental funding is not a bottomless pit of money. How can we defend additional allocations of unemployment and food stamp dollars? A recent study looked to identify the relationship between economic status and food security and actually found that among households with incomes below 130% of the poverty line, the households that meet the gross income test for SNAP, 52% of SNAP participants reported being food insecure compared to 28% of non-participants. An increase in SNAP funding, as previously stated, is just a band-aid on the issue, as the increase in funding will only last through June of 2021. The funding instead, if allocated, should be appropriated for education of SNAP participants. Other governmental programs that aid food security, including the Commodity Food Program, Women, Infants, and Children, Summer and School Lunch Program, among others, all hold mandatory nutrition education requirements to gain and maintain food dollars. Therefore, the problem of food stamps is not with a lack of funding, but a lack of education. If any additional allocation should be distributed to the SNAP program, it should be solely to the education piece. Increasing the funding of the SNAP Ed piece would simultaneously increase the job demand with more positions available for educators and other jobs in rural and urban areas, and educate SNAP participants and families on budgeting dollars and buying healthier food items. Thank you.
And now we will begin the review. Okay, so people were affected by the pandemic and lost jobs, and lost their income and had to turn to federally funded programs such as SNAP. Which the SNAP increase won't last forever. It'll only last until June 30th, approximately 6 months. And this forces the Americans to not be so dependent on SNAP. So they have to get back out there and try to find a job, and try to find another source of income so that they can feed their family and feed their kids. Personally, it should have been increased a long time ago, especially when schools shut down, because some kids' lunch and breakfast are the only meals that they'll get at school or at all that day because of circumstances that they live in at home. They're probably not given meals at home by their family, again, because of the circumstances they live in, and that's the only meals that they get. So personally, it should have been increased a long time ago.
Yeah, Alexis, I I agree. I also want to add to that um, about the healthcare. Early access to SNAP among pregnant mothers and early children improved birth outcomes and long-term health as adults. it also helped elderly participants who participate in SNAP. They are saving more money on their medicine and not worrying about having enough money to buy their medicine when SNAP is able to help seniors live more dependently and avoid hospitalization. And it is also said that people who experience food insecurity are more likely to put off those prescriptions because of that. And, you know, in return, SNAP may help those participants be more adherent to medication regimens by improving their food security and reducing their out-of-pocket costs for food, freeing up resources that might be used for medication. So in all, it just helps, you know, with healthcare, and it lowers that cost.
Thank you. And I think I do have a few points to touch on based on what both Bianca and Alexis mentioned. Overall, I speak for Laurie and myself in saying that we would admit that SNAP is important and beneficial program for many people. Many years of program allocation, success stories, and article reviews will indicate just that fact. However, the supplemental assistance program should never and will never completely cover the grocery bills for low-income families. It should maintain its place as an assistance program along with other governmental programs, some of which you indicated. For pregnant and early mothers, there's the WIC program. For seniors, there's Meals on Wheels and senior centers. If any allocation is appropriated to SNAP, it should be to where the flaws are already indicated.
And the argument is not against SNAP as a program. As we all agree, it's a program that bridges the gap when Americans are in dire need of food assistance. And we believe that this is not the responsibility of the federal government to endure, which in turn raises all of our taxpayer dollars. Even in the aftermath of the last recession, there was a lasting expansion to SNAP, which was originally sold as being a temporary relief effort, but that never happened. Again, response should be taken at the state and local level, as well as with the private sector, as they can better understand the unique needs of residents within their specific state, especially when it comes to responding to the emergencies like that of a pandemic. The increase also doesn't address food access, as 20% of Americans live in a USDA-defined food desert. Therefore, people don't have access to fresh fruits and vegetables, and SNAP dollars aren't being spent on what it's meant to be spent on. This is where we need a pointed local government response instead of the federal government stepping in and placing a temporary fix to a much larger issue at hand. And I'll say it again, we need Americans to not just survive this carnage that is this pandemic has brought upon us, but thrive after all is said and done. I guess that's the end of our debate.
Thank you.
Congratulations,
Great
guys.
job.
Thank you.